sometimes, what you need for a break or a lunch is outweighed by what the patient needs.
Hello, everybody. Welcome back. This is Damon Johansson with HR Mingo. We are back today with a guest to give us the 411 on all things nursing. So we were able to talk to him a little bit about his career in another video. If you didn't see it, totally worth watching. Find it. It's out there. If you are tuning in today, we're going to talk about hot topics in the nursing field. Big issues in the nursing field. What's it like to be a nurse? What are some of the realities of being a nurse or working in the medical field? So today with us, we have Dave Lamb. Welcome, Dave.
Hey, thank you. Appreciate it. Glad to be here.
All right. Well, thank you.
Yeah.
So we have a few things that are hot currently in the medical field, specifically to nurses.
All right. This should be interesting.
One of the things that I didn't think about that came up top on the list for nurses is cultural competency. Like, I understand nurses travel. The company you work with, what's the company name?
Oh, it's CHG is the name of the parent company. Right. The nursing division of that is RN Network. Okay,
so the RN Network, and that's who you work with specifically, right?
I don't work with RN Network specifically. They kind of do their own little thing.
But you know enough about the nursing side of things.
Yes.
That's your career background.
Yes, exactly.
So I never thought about cultural competency as a nurse. So I'm assuming that means, I'll read it. So we're even saying that as nurses are exposed to more clients from different cultures, it's important for them to develop a cultural sensitivity approach to their practice.
Absolutely. Yeah. It's very tricky because depending on your background, where you grew up or maybe even what race or culture that you come from, it can be religions. Yeah. Religions are a big one because a lot of times most people, we don't really investigate too much into those cultures, because it's not my culture, it's their culture. And so part of that problem is when medical care comes up for these people, they have certain standards, or let's say, for example, some religions are very conscientious about having their body exposed. Okay.
Right. Very conservative.
Very conservative, yes. And so it's very, very difficult sometimes to work with a patient like that because their culture is telling them, no, I need to be covered up. I'm not supposed to be exposed. But of course, our job is you sometimes have to get in and do whatever you have to do to help, wound care or other, medication administration, things like that, where that does kind of require that. And
so the nurses learn, maybe with this culture, everyone has to leave. I have to close the curtain.
Exactly.
I'm not going to be able to examine this person, knowing their background, knowing their religions, unless I do this.
Exactly. Yeah. Okay. So you have to be aware of those. And really the only way to know that is either through experience or by studying it. And obviously studying it beforehand is going to be much more beneficial because then you're ready for that. But sometimes you do learn it by experience and it can be a little embarrassing and awkward, but I think as long as you are understanding that your view is not the only view out there, then you can be a little more adaptable to what the patient needs.
All patients.
Yes, exactly.
Okay, so that's fair. It's probably learned. I'm sure you make mistakes.
Yes, you do.
Oops, sorry. I didn't even think about that one.
Yes, exactly.
Well, that was an interesting one. I hadn't thought about cultural competency. How often is it U.S. nurses travel abroad? Or would they go work internationally?
Not too often in my experience. They can, but in most cases...
Service? Maybe volunteering or something?
Exactly, yeah. They'll do service missions with physicians will go, and then the nurses will go with them to kind of assist and carry out orders for them and stuff. So there are opportunities to do that. You would have to look into specifics. I haven't even looked into that to know what kind of companies do that. Okay. But for the most part, with my company and nurse traveling, we stay within the continental United States.
Okay. So the next one, this is a big one.
Yes.
Everyone, pay attention. If you're only here one topic of this whole video, this is the one.
Yep.
Nurse burnout.
Oh, man.
Tell us about nurse burnout.
Okay. Nurse burnout. So we talked a little bit about this in the last video where I talked about having 312s. So 3 days, you work 3 days generally in a row, 12 hours each day. So
you get what, 2 breaks and a lunch break?
If you're lucky.
If you're lucky.
Yeah.
Oh, if you're lucky.
Yeah, if you're lucky.
All right, for all your employment law people, you didn't hear that.
No, of course
Yes,
not.
They get all their
Yes.
breaks and their lunches. Okay.
Exactly. No, they sometimes, what you need for a break or a lunch is outweighed by what the patient needs. Patient's needs sometimes come up much more urgently. And that's kind of an ongoing joke with a lot of nurses is, I can go 12 hours without taking a bathroom break, things like that.
Oh, that's not great.
No, it's not. But sometimes
It's not healthy.
No, it's not.
These nurses are supposed to help us be healthy.
Right. But if we're not there when the patient needs us, then we can suffer the consequences of that. So That's a whole other story. But anyway, burnout. So when you talk about 312s, sometimes you can do more than 3 days or 3 days in a given week. So say, for example, I might do 3 days, have a day off, and then do another 3 days of 12 hours.
Oh, with only one day off.
Yeah, with only one day off in between. The following week, you'll get a bunch of days off. But sometimes when you have those 312s and another 312s right after.
For all those who don't know, those are called rotating 12s.
Yeah.
So whenever you interview for a job and they say it's a fixed 12-hour shift, that means you have the same days every time, 12 hours. If it's a rotating 12, which sounds like it's very common
It can. Yep.
for the coverage, then it changes every week.
Yep.
Hard for holidays, hard for family time.
Absolutely. Oh, it's brutal.
Okay.
But putting in those kinds of hours, back to back like that, it is extremely exhausting. And honestly, when you're a patient, it's kind of scary to think you might have a nurse who's on their 6th 12-hour shift and they're exhausted. Their mind might be somewhere else, whatever. And that's
nice
kind of be nice to your nurses, please.
Okay, so what they highlighted were long shifts, stressful work environments,
Yes.
and understaffing.
Oh boy. Yeah. Understaffing is, again, it's all subjective on where you're working. Some places are fantastic. And profit
margins for executives.
profit margins. Yeah. But some places are really, really good about that, and they keep their staffing adequate. However, there are some places who are going to try to get the most out of you, and it will burn you out, unfortunately. And
so keep an eye out for those patterns.
Yes.
Where employers are running thin. They run low staff often.
Yes.
So maybe ask those questions when you're working with somebody. Say, hey, how often are you short staffed? And if they say a lot, that could be a red flag.
Absolutely.
Okay.
Absolutely. And I would even go so far as to say to keep your resume out there so that you can find what fits best for you if you run into one of those jobs.
So another hot topic in nursing, in the medical field, and I didn't realize, I didn't necessarily separate them in my mind, is mental health. So you have nurse burnout.
Yep.
We understand what contributes to that.
Right.
But that almost goes side by side with mental health as a nurse.
That's true. Burnout is a contributor to that, but also outcomes of your patients. A lot of nurses, me included, we try to do our best to be separated from the patient, but it's another human being. And so it's almost impossible not to make a connection with some people. And when things go poorly for that person, it affects you. I've seen many, many nurses who have broken down and cried because of a poor outcome or even a death on a patient. And when that happens, it gets to you mentally. But it's one of those things that you just have to be prepared for, that when it does happen, have that support system in place for you.
Talk to family,
exactly.
Talk to friends, talk to therapists.
Therapists, yes, exactly. Have those people around you. If you try to internalize it and do it yourself, you will burn yourself out. Absolutely.
Okay. So mental health is important, and it's safe to say every career field, mental health should be a top priority. Don't be afraid to talk to people. Don't be afraid to confide in others.
Yep.
So what are your thoughts? I know this isn't your career field background of telehealth. The big thing that's kind of coming up is pick up the phone and talk to a nurse. Don't spend the money and go visit the nurse, talk to the nurse.
Sure. Yeah, telehealth is an interesting, and you're right, it's gotten bigger lately, mainly because of the pandemic, where it became much easier to have these consultations with either nurses or doctors over the phone, and then there's no risk of exposure to each other. In a lot of cases, a nurse can help you with an issue that you're having once you describe your symptoms, maybe even a photograph of a wound that you have or something, and they could give you
prescriptions over the phone.
Nurses can't, yeah, but doctors can.
Doctors can.
Yeah.
So the nurse, if you're talking to a nurse on telehealth, then they would convey to the doctor and decide what goes from there.
Exactly. Okay. And then the doctor would weigh in. And generally, doctors, they would only be able to prescribe things like antibiotics. They wouldn't be able to prescribe opioids, things like that. Over the phone, right?
Okay. That's good to know.
Yeah.
The next one for nursing is ethics. That's so easy, I would think, for nurses to get caught in maybe dangerous situations with patients, dangerous situations with medication, dangerous situations with coworkers.
Yes, absolutely. And unfortunately, there is a lot of trust that is placed in doctors and nurses. They're one of the highest trusted occupations in the country. They always rank pretty high. And so with ethics, unfortunately, the nurses are human. And they will make mistakes, and sometimes
overworked,
on
the edge of burnout.
Exactly, and sometimes it is intentional. The things that they do, they do have nurses that will attempt to steal medications or other things like that. There are things put in place in order to checks and balances, so to speak.
Try to help the honest.
To keep everybody honest on that. But there are people, just like anybody else, who have their addictions or issues and are trying to get these medications. And unfortunately, unless they go get help, that's always going to be something that they have to fight with, So
that's very important.
Absolutely. Yeah.
All right, last one, nursing research. So I relate that, like in the human resources industry, you have to get ongoing training to stay certified as an HR professional.
Yes.
You have to get ongoing training of current employee issues, current employment law, current things that are happening. So in this nursing research, that it says specifically that nursing research is a key role in the evolution of nursing and driving improvements to patient care, healthcare policies, and or well-being of individuals. Do you deal with any of that?
Yeah, absolutely. In fact, now that you mention it or you phrase it that way, we are required to have training in order to renew our license. So nursing licenses have to be renewed every 2 years.
Okay.
And part of that renewal is that you have to show that you've done a certain amount of research.
Just like HR.
Yeah, exactly. You have to do that. Or the other option, and it depends on the state you're in, but the other option would be a certain number of hours working as a nurse.
Practical hands-on experience.
Exactly. So one or the other, sometimes both, depending on the states. Some states are much more strict. But once you meet those guidelines, then you can renew your license and then go on another 2 years and just keep, continue going on that way. So, it's important.
So that is ongoing education is pretty critical in the medical.
Absolutely. Things are changing all the time. And so you have to keep on top of that.
Okay. Yep. Well, Dave, thank you for coming in today.
Yeah,
you
bet.
For talking about some fun, hot topics in the nursing career field.
Absolutely.
So for all of you that might have ambitions to go into nursing, hopefully you learned something from the video today. Share with your friends, like and subscribe. And thanks for checking us out. Have a great day.
Thank you.